The doctor's office is moving closer to your pews than you think. In many healthcare deserts, the church is only trusted building left. Today, we're teaching you how to partner with hospital systems to put a high-tech virtual clinic right in your fellowship hall. Welcome to Develop by Faith. So too often we find that your congregation and neighbors are traveling 45 minutes for a basic checkup. We kind of talked about what you're doing, and how you were able to pull everything together. And you said that a medical facility hasn't been in that community for over 100 years.
Yes.
So now we're saying that this not having access to medical treatment, for one, is a real big concern in a lot of communities around America. The second thing is, sometimes when you're dealing with these specialty doctors, they can't get around it. Like I always say this, when people are coming to the church sick, they come to the church for prayer. Why not give them prayer and a professional telehealth link to a cardiologist or to their lung doctor or whatever they may need, right? I feel that with this model, it changes so much because going back to what we said about baby boomers, right? A lot of people I've known has been up in age. Some of them just stubborn. They don't trust doctors. They'd rather take chew on a root, drink some kind of tea, and get up at 5 a.m. in the morning and say a prayer and be done with it. And I'm not saying that don't work. What I am saying, sometimes you can have preventative care by just going and speaking to someone. Just saying, hey, this is what's going on. I have a problem. When I eat this, I got a problem in my hip.
Right.
Or when it gets cold, my joints lock up a little bit, right? Or I have a bad thriving in my head when XYZ happen. But if you can have someone to be able to, that's a professional that can say, hey, you might want to look out for this, and this, do this, do that, blah, blah, blah. I feel that if the church can bring that, because people trust the church, we can get the church to bring that all in together, right? Then we will have such a better experience in those baby boomers. Those baby boomers, pastor, who is spinning, getting those tithes up. You can have them live longer. You can have them live longer. I mean, it's going to be if we're looking at reality of everything, if my consumer, right, if I'm just saying the tithe model, we know we're different here at Developing Faith. We believe in being a community resource center and accessing multiple streams of income and doing it very well, very successful, right? So, but those average churches out there that just have, tithing from their members, if they're dying out and they're not getting adequate care, things just go left. I have to tell you a story. I had a good friend of mine. It was his aunt. His aunt was diabetic. She went to the church faithfully, made great money, had a pension, and would donate a lot of money to the church because she believed in giving back. The thing with her was she went outside barefooted and nicked her foot. They end up cutting off her leg. Then they end up cutting off amputating another part of her body.
Yeah.
Then she ended up dying from it being infected.
Yeah.
But her mentality was, I don't want to talk to nobody.
Right.
But by the time she started to talk to somebody, it was too late. Her body became septic, and she ended up dying because of that. If she had someone, right, after church that could have said, hey, get on this telehealth laptop at the back, talk to this primary care doctor. Don't worry, we got different plans and stuff we can put you on or whatever, or we have a case manager that can help you out. Right, by the way, once you get seen by the doctor and you need somebody to come by the house, we can set up where you have a nurse come in home to check on you. We ain't trying to tell you what to do or take you away from your regimen. We just want to make sure you're good.
Right.
She will still be alive.
Yeah.
So, pastor, it's almost like it's your responsibility to be able to put that. But with that being said, Odell, I'm not going to take this away from what you've done. Look, y'all just may look at this handsome man here and laugh and joke and stuff like that. I'm going to tell you something. This here is his baby. I've seen him start from from the bottom, and now we here. He got a real good thing going. He has a real good connection with a real big national hospital organization, and he helped bring and bridge the gap to a community. But I'm not going to keep running my mouth about this. I'm going to let you guys hear from the man himself. Odell, please speak about your experience with this.
Well, let me first say that this is near and dear to me. As a child, I watched my mother get misdiagnosed when we were in Charleston, South Carolina, and the fact that she was having a stroke. She went to the hospital. They sent her home. Anyone who knows anything about a stroke, we know that seconds matters, so hours matters. They sent her home, and they said, come back on the free clinic day. Now, my mother was working full-time for Manhattan Shirt Factory, and she had insurance. But the doctor there said, come back. So they sent her home, and thank God that my grandmother had a doctor who came and did house calls in those days, and he came 2 days later and said, hey, we know it's a stroke, and he took her back to the emergency room. The doctor there argued with her, said, I told her to come back on Tuesday, the free clinic day. Now, we've been dealing with this since Friday. Wow. So he took her back Saturday, and he said, come back on the free clinic day.
Which is Tuesday.
And that doctor, thank God for him, he forced them to admit her, and she stayed in the hospital for 4 months.
Wow.
And the whole thing on that just left an impression on me as a boy, and saying, when I become a man, I'll do something about that. So that's why I'm so passionate and adamant about accessible health care. Now, I didn't know at that time I'd be a minister, but as a pastor, I believe that the church is one of the most trusted and accessible institutions in the community. Now, we have, as people of color, we have a history of somewhat not trusting healthcare because of some things that were done. We could talk about Tuskegee. We could talk about a lot of different things. However, what I've chosen to do is to take the trust of the church and wrap it with what we need from the healthcare system. It's almost like the healthcare system putting on a coat of trust of the church to work together, not a wolf in sheep clothing.
Yeah.
Because we're there with them, we're talking through it, but with telehealth, with bringing in, you mentioned what I'm doing, a 40,000 square foot medical office building, $30 million putting there on the church property, and having telehealth offices inside, bringing in mobile units. Is so many other things that could be done. I'm working with an additional church, and I presented this proposal last night to them, that when the pastor shows up with his vision and he says, I want to do senior housing, I want to do lunch, I'm saying, okay, well, let's fold this healthcare clinic inside the senior resource center. That does a lot of things. That means that everybody who says that they have to take time off from work to take their mother to the doctor, or take their father to the doctor, or check on them, well, the doctor is there. The doctor is in the house. The doctor's in the house. So you build the house of God, and the doctor is in the house, and it takes care of a lot of that, because now your constituent doesn't have to leave work and pick up mom, take her to the doctor, and come back and understand everything. The doctor's there. And that makes all the difference in the world. So now the healthcare institution is paying the church X amount of dollars for access and renting the building, because the building is there anyway, right? So now mom is seeing a doctor. Now the son or the daughter doesn't have to take time off from work, and everybody appreciate what the church is doing, because the church is, to your point, is keeping its constituents alive, because it's more than just spiritual health.
It is.
It's mental health. We don't talk a lot about that. We can talk about that another time, but it's physical health and the social determinants of health. Everybody understand that is that X amount of percentage that what's going to heal you happens in the hospital. Let's just say 30. But the other 70% is what happens outside the hospital. Do you have access to your prescriptions? Do you have access to your follow-up visits? Are you in a safe environment? Are you in a stress-free environment? And I know it's no such thing as stress-free, but I'm just saying we have a church full of people doing missionary work, and some churches will send people halfway around the world to care for people. Can you send them around the corner?
Yeah.
Can you send around the corner to make sure Susie Q is taking her meds on time.
Yeah.
Can you just come in there and help them if they don't have any insurance on how to get served? And again, listen, my passion is not anger. It's just that when you have a personal experience on how this can change your whole family. My mother had a massive stroke at 25. She was a divorced single mother with 4 children.
And she had a stroke.
Had a massive stroke and got sent home for 3 days. And we are still living with the consequences of her being sent home because she's been paralyzed. So it's just interesting how all that goes together. So you can look at it one or two ways. You could be mad at the world, or you could take those feelings of being disappointed that my mother was misdiagnosed and use that energy to help somebody else. And I choose to help other people.
Again, y'all, this man here is very humble, very, very humble. I like how you just kind of said, yeah, we got the 40,000 square foot building and everything. See, I know the story. And another day we're going to talk about structure and how everything is. Did y'all have to sell any of y'all land to do that?
No. Everything's long-term lease. But humble, yes. But remember now, as a child, said, God, if you allow me as a man and give me an opportunity, this is what I'll do. You know, we make a lot of promises to God. The church house is full of promises and prayer requests. And God, if you, I will.
Yeah.
So now we're looking at taking the church house and bringing healthcare into it instead of always having the people go see, we're praying for you. Yeah, we're praying for you. But to your point, we're doing more of the prayer. And that is what we're making sure, because some of the time, the follow-up, something as simple as a urinary tract infection. I've learned this because I'm a caregiver. And that's the whole thing. We care for people, but who's caring for the caregiver? You know, who's caring for Key, who's taking care of his mama, or Odell, who's taking care of his mama, or Gerard, who's doing this? Who's saying, because nobody asks you how you doing. No. People ask the question, how's your mama doing? How's your daddy doing? How's sister doing? But can someone say, Odell, how you doing? Because I'm about to lose it, y'all. You know, I'm stressed out. I'm sandwich generation. I have my family. I have my children. I have my grandchildren. And I'm trying to take care of my mother and all this kind of stuff. And there's so many people are getting burned out as a caregiver when the church, a trusted and accessible tool in the community, could be a respite place. And respite just means, let me take your mother there and let her stay there for most of the day and give you time to do whatever you think you need to do.
Yep.
Something as simple as just go home and take a bath.
Yeah.
Or go to the movies by yourself, or just go to sleep. So that's ministry, and that's the church can do it, but also it brings revenue in, not charging the people per se, but just working and looking at this tool that we have. How can we help, and how can we help save lives? Because to your point, preventive care is so important.
Yep. We always talk about deferred maintenance, right? Sometimes you have to do maintenance on yourself. And when you're in this world where everybody want to run, and you're trying to make sure that you're good, sometimes it's your loved ones. Like you spoke about your mom.
Yeah.
Right? And if accessibility was there, it makes it a lot easier. Some people can just walk to their community church, right?
Yeah.
And they don't have to necessarily be a member there. See, a lot of times we think when I talk to pastors about this, they always say like, oh, my congregation, da-da-da. I'm like, I don't really, yeah, your congregation is important, but this is about the community.
Community health.
I remember when I was young.
You're still young.
Yeah. I remember some time ago, right? We had to take my brother to the hospital, and long story short, it was at a family cookout, and my uncle was at my uncle's house. My uncle had one of those stationary bikes.
Yeah.
And my younger brother, people who know me grew up, my younger brother was like I don't want to say he was bad. He was a lot.
Rambunctious.
He was very rambunctious,
That's
right?
the word they use. Yeah.
And he now you meet my brother. He's like very laid back, calm. He don't recall a lot of stuff. I'm like, dude, I got stories because you terrorized me so much. And it wasn't just him. I was the older brother, and I was responsible for his well being. If that makes any sense, right?
Right.
So I'm on this bike, riding this bike, and he takes his hand. I said, "Hey, Tyler, leave it alone." He puts his hand and got caught on the chain, and it ripped his index finger. And my mom and dad like lost it. You would have thought that I killed that boy.
It's your fault.
Yeah, it was my fault.
That he stuck his hand in there.
Yeah, even I told him several times stop, and was trying to get off. I wasn't even pedaling when he did it. Anyways, chain was going. He did that. Bam. I remember from where my uncle lived, right? And my uncle lived in a great community. But the major hospitals in Charlotte are downtown. So they had to drive all the way from the suburbs. This is before they had built the hospitals up in the suburbs. All the way down. And my brother was just crying, yelling, screaming, crying all the way there. Now, if it was a life or death situation on that, he might not have made it if he bled out.
Well, but you just hit the nail on the head, because you mentioned earlier that what we're doing in East Greensboro, it hasn't been a new medical office building since L. Richardson in 1926, and now it's 2026. So you ask yourself the question, why, with hospitals and medical office buildings popping up all over Greensboro, why isn't anything popping up on a certain part of town? Why does it take 100 years? So you say, why, Lord? Your people are crying out. And the fact that certain things happen on one part of town, how many people die on their way in the EMS on their way to the hospital, but no one says they died on the way. Either they say they died at the scene, or they were pronounced dead
when they arrived.
And that's different. But more importantly, back to preventive, because that's the extreme, and anybody can work from the extreme position, and we don't want to manipulate the situation. What we want to say is this. This weekend, I went home for Easter service, Charleston, South Carolina, and had a conversation with a family member, and we were talking about prostate cancer and getting examined. And what he said was, Dale, I'm trying to talk to people because he's been diagnosed and nobody want to talk about it. Guys don't want to talk about it. Well, this whole thing about I'm not going to get examined, I'm not going to let somebody, a professional, put their finger up my behind to check my prostate. That's crazy. I'm not going to get treated because, if I get it treated, I can't be sexually active. Well, the last time I checked, if you're dead, you're not sexually active. That's just the way it is now. So what do you want to do? So I think, to your point of the young lady you were referring to earlier, if the church makes it a safe place for men and women to talk about health and healthcare needs and concerns, if it's normal, then we don't have to worry about Sister so-and-so who have diabetes don't want to talk about it. Well, you don't have to talk about it, but usually she'll listen. What we find in the church, the power of the pulpit, she will listen. He will listen. So if the doctor or the pastor talks about prostate exams and how important it is, and I did it, raise the hand, to your point, raise your hand, then all of a sudden, others would say, you know what? I'm going to go get my prostate examined. And maybe if I catch it earlier, then I can live. Then I could take care of my family. Then I could dance with my daughter at her wedding. Or in my case, I want to dance with my granddaughter at her wedding day. I want to dance with her. So being transparent and open, I think the church, whether it's a virtual clinic or a clinic in the box, and I want you to talk about that, or the healthcare institution itself coming in and actually partnering with the church. Either way, we need excessive access to affordable and reliable and quality healthcare. So this thing you mentioned, a clinic in the box or a doctor in the box or virtual clinic, elaborate about that a little more, please.
All right. So we know the need, right? What we've started to notice is that when COVID happened, telehealth became real big. We've actually partnered with a very reliable telehealth company, And we've also partnered with a prescription drug company that can send prescriptions direct to you. And I can go in for days about what they do. I can, if you're interested, raise your hand, reach out to us. I can send all the information about it and how to set up. But let me talk about the clinic in a box, right? The clinic in a box is so important because we've seen where churches have taken 2-3 Sunday school rooms and turn it to a HIPAA approved facility where individuals can come, they can talk to a virtual doctor and be connected with a local nurse practitioner that can help them out in their community. What that means is this. Say that Miss Suzanne, is having issues with breathing, and it might take her an hour to go from her house to the hospital.
Yep.
Then she got to wait in the waiting room, in the emergency room.
Catch the bus,
or get a ride,
or
even
call
drive
EMS.
Call EMS.
What the county EMS guy told me was this. He says, Odell, people use the EMS as a taxi to get to the hospital.
Yeah.
So now that's the most expensive Uber ride out there.
It is.
So it behooves us all to work together to serve. We could do better.
Do better. So you have her. She can then get a ride or walk or however to the church. She can meet with a telehealth doctor. Now, here's one or two things. If she has internet and such at her house, she can do it at the convenience of her own house.
On a cell phone.
On a cell phone?
On a cell phone.
She can check and see, talk to them, let them know what's going on. That doctor or nurse practitioner can prescribe prescriptions, can set up follow-up appointments. They can even be able to get her to have home care, where if she has a problem going to the doctor can send someone out to go to her.
Right.
And have it on a regular routine. So what we came up with the clinic in the box is set up. We have a hub in a church. We'll have the nurses and nurse practitioners going out to the community. However, we cope it with telehealth, where you have access to doctors 24 hours a day that you can talk to directly. And they can prescribe prescriptions, find out what's what. And then if it gets to a point where it's extreme, where you have to come in, they can work with you on doing that too. And we've noticed that since COVID, this became so popular, and it doesn't really cost that much for a church to do that. Right. I mean, if you think of it, if I have 3 rooms, right? And again, we have an example of a church that pretty much set up these 3 rooms, changed everything, was able to get secure Wi-Fi, was able to get soundproof, walls and everything to make sure it's good, and then have their own private entrance, right? They were able to pay all their utilities with that lease from this clinic, right? But furthermore, being able to connect your congregation and community with it. It might be a situation where, in some areas, I noticed there's been a rise on STDs, right? And treatment for STDs, just like you said with the UTI. It might be something where somebody may have gonorrhea, chlamydia, or something of that nature. They, instead of going to their primary doctor, which a lot of times they don't want to do that, they can go to the clinic, see somebody, get treated, be helped, right? And this might be somebody who, may go to the church, or someone who don't go to the church.
Right. Doesn't matter.
It doesn't really matter.
Yeah.
Now we open it up to serve more people. And the more people get with and coming to somewhere, the more that they feel familiar, the more they feel open. The next thing you know, you have people in your congregation showing up to be able to say, hey, I like this. Or if grandma like is getting treated from the church, and she may not go to church, but if she know that church is there helping her out, and you might partner with that doctor or that physician to talk about different things for preventative things on a Sunday or Saturday or whenever you worship, you can have these individuals come in then just to talk or just to ask questions then and there. It really goes against any pastor who wants to make sure that they have a strong, healthy, and wealthy congregation not to do the clinic in a box.
Well, it's interesting when we've done this because we're talking about proof of concept. This is not just something we're thinking about, something we've already done. And when the Healthcare Institute comes in, they said, well, we want to do all kind of services, but first we want to find out what the community needs. And something as simple as just occupational, meaning that if you are companies close by, they'll send them there for their physicals. They'll send them there for all the checkups and all that kind of stuff. But also, let me say this, pastor, him or her, you can't take care of the congregation if you're not taking care of yourself. And in a lot of cases, you're taking care of everyone, running around, visiting everyone in the hospital when you should slow down and do your annual checkups and get all your things. And if you're a male, by you leading by example, the other males in the church will follow you. If you're a female, by you leading, for example, the other females will follow you. And as you do it as a family, you want your congregation whole, because when you start thinking about diabetes, a lot of it is eating and taking care of yourself and, doing those necessary things. In a lot of cases, churches have healthy cooking classes. And people come in from the community to do that. We already have the kitchen.
Yeah.
The sister so-and-so already using the kitchen.
She already use it.
We know she's using it. So, you look at it. And again, this is something that could benefit the church. Revenue comes in, but also you're helping the people. And I think the last time I checked, Jesus gained a lot of following by taking care of the people, no matter who they were. Like the blind man, he said, all I know, I once was blind, but now I see. So you take care of the people, and the people will take care of the church.
That alone. Like that's the law of reciprocity. You just, what you put out is what you get back. And with this model, it just hit home because so many people have been misdiagnosed. So many people have, been like, I can think of so many times if I'm a young man, right? Some people just don't trust or like doctors, or just don't have the time of day to wait to speak to someone. I know we talked about the cardiologist, right?
Yeah.
Sometimes, my mom recently had a stroke, and her cardiologist is like 2 months down the road for an appointment after she got discharged. 2 months. And he was like, hey, can we get him to speak sooner? And he was like, well, he's booked, right? He's booked. And I can't get upset with that, because when you do good business, you get a lot of people.
Yeah, but it's other ways around that, though. It's other way around it. And I don't want to question what they're telling you.
Yeah.
But what I will say is that if you build your own system,
Yep.
it wouldn't be 2 months wait.
I agree with that. And I think this is why it's so important.
Yes.
When you build out you can have a little bit more control, more relationship with everything. I mean, just what we were saying with a physician or a PA, physician's assistant,
right?
Being hands-on with the church, being in the community with the church, hosting things in the community with the church, talking about Health Day, talking about different things, how to change this, how to change that, adding more programs, allowing that physician's assistant or that doctor to be able to really engage and embrace the community.
Or RN. A good RN makes all the difference in the world. I just think, too, though, that people who understand the culture, because I think the only example I would use, Serena Williams. Serena Williams, a fantastic athlete, Black female. When she went to have her baby, she had challenges, and the doctors didn't understand or listen to her. You have to have doctors who will listen to you.
I agree.
And understand you and kind of go from there. So I just think that the church grow their own, and more than just that, but what we're doing too at other locations is the fact that if you have the physicians coming in and other entities coming in, then what we say to them, I need you to mentor some of the young kids in the church.
Yeah.
Whether they want to go into med school or not, mentor them. Let them see what you do. Let them see and experience how this works. So you just don't go into the emergency room. You don't go into a doctor's office. Grandma just doesn't show up with an amputated leg. It's a reason for all these things. And I think once you understand the reasoning behind it, then you can go a little further upstream and intercede with the 7 terminations of health, and makes a difference, because at the end of the day, one thing COVID taught us, we were having funerals. And when the churches closed down, we went from a house of worship to a house of service. And we served people. We fed people. I remember being out there before it was a cure and vaccines, putting on the mask and giving people food. And remember, as a pastor, you would have to make a decision because the state of North Carolina only allowed X amount of people at the funeral. Let's just say it was 20, and Uncle Bobo was number 21, and he couldn't come. All the rips that caused, that people still upset, why couldn't I come to my brother's funeral? All those things. So it's just so much things we can do here, so much opportunity we could do here. It's so much grants and unrelated revenue could come into the church, but more than the money is healing the people, taking care of the people.
Well, you said something real big. You guys, I'm real big on systems and models. So we're going to talk about calculating the community health impact value, right? And we know that it's annual lease income plus grants available for social determinants. Can you talk about that and your experience?
Yeah, social determinants of health. Everybody understands it. It was big a couple years ago. Now we're still talking about it. But now the thing's going from the social determinants of health on where you live, the amount of stress, food deserts, healthcare deserts, and all that, into this new thing called intelligent aging, where you allow AI and other advanced entities to help you, right? To help you understand, because it was one time, if I wanted to check your temperature, if you were a baby, I took the thermometer and put it where?
Under your tongue?
No, up your butt. If you were a baby, in your butt.
Oh, okay.
You're too young to understand that.
Yeah, I am too young.
Okay, yeah. Then other time we'll put it under your tongue. Now when you go to the dentist, they have this little clip on your finger to check your blood pressure.
Oh, wow.
And check your thermometer.
Wow.
I mean, your temperature. So things are progressing. And what I love about my research and studies and writings about, advanced intelligent aging is the fact that you can stay in touch with individuals and know where they are. It's almost like you could put on a watch or a band, and at the end of the day, it can monitor all your heartbeats and everything else, correct?
Yeah.
Your footsteps and everything else. Why can't we apply that technology to aging? Because in a lot of cases, that's where it hits the road.
Wow.
Because I say this, I saw my mother the other day again. My mother is in a facility. We took care of her at home as long as we could, and we couldn't. For those caregivers, you may understand what I'm saying. So I'm going to look you in the eye. The day you walk into a room and your loved one do not know who you are, is real. So I walked into my mother's room on Saturday, and she didn't know who I was. And she said, well, who are you? Because my mother can get proper sometime, right?
Yeah.
And I said, I'm your oldest son. I'm Odell. And she said, oh, you're Odell. How you doing? And she called me Dell. She called me Dell or Pumpkin. Pumpkin is my nickname. And the whole idea of that's the first time ever walking into a room and my mother didn't know who I was. I had to tell her. But that's the cycle of life. So what do we do when we care for those who cared for us? And as we close this segment, this is the real part. This is why the young lady said, I don't want to talk about it. Yes, I have diabetes. Yes, they cut off my toes. Yes, they cut off my leg to the stub. Yes, I don't want to talk about it. So if I don't talk about it, is that denial? Don't know. And everyone has their preference because, healthcare is a private thing. However, if we talked about it, maybe, just maybe, she would still be here talking.
Woo. Boy, that's sometimes it's decisions that others make can affect and impact thousands.
Oh, yeah.
Unintended
consequences are still consequences.
They are. And you guys, put it out there. I mean, you guys can just put a computer in the room and say that it's a clinic, but you really need to navigate HIPAA compliance and specialized medical liability insurance to be able to do that. Now, I will say this. We have the MOUs, memorandum of understandings, that hospital systems actually sign. If you want to see your building, if your building qualifies for this, book a healthcare feasibility call today. We have the relationships, we have the partnerships, we have the experience. We can connect you with our partners at the virtual clinic, and we can talk about how we can help you become a virtual healthcare clinic in your community and even help you be able to grow that business out. However, you can look at this, you can keep scrolling, or you can like, share, comment, and subscribe. Reach out below, reach out to us, set up a call, and think about all the people in your community that you will actually help out. All the grandmothers, aunts, uncles, grandfathers, even kids that will benefit from this service, all because you chose to make a call just to get some information. Odell, any final words?
Well, the life you save may be your own. I mean, you think about it, you don't have to reinvent the wheel. We have these things. We've already worked the kinks out. You know what's going on in your community, but more importantly, you know what's going on in your family. You know that you're the one, whether you're the pastor or whether you the deacon or trustee or anyone, none of us get a get out of jail free card. We have family members, and who's helping, who's taking care of them, who's the caregiver, and who's caring for the caregiver. All those type of things is real. So let's be more proactive. Let's bring resources, healthcare resources to the community, to the church, and let's not be in denial of what's happening. If we have a condition, then let's treat it. We can live with it. Let's treat it. If we have a situation, let's not say, well, I'm not going to talk about it. People are dying. If we know that men have prostate issues, let's let other men talk to them about prostate issues. If you're concerned about being sexually active, let's talk about that. If you're concerned about, will it hurt? Let's talk about that. If you're concerned about, will it make you less of a man? Let's talk about that, because we all, not all, many of us has been through it, and we could talk to you man to man about what it takes, because what we will share with you is this. Your decision-making process will affect so many people, either positive or negative. So we ask you to choose life. You're not less of a man if you lose your prostate. Come on now. Let's work together, because the family, the community, we're all dependent on you. We're all dependent on you. We're dependent on each other. That's all we have. The Calvary is not coming. We are the Calvary. And like you stated earlier, everything that the churches need is in the house. The doctor is in the house.
You all, thank you for listening to another successful and impactful episode, I should say, of Developed by Faith. I am Key Ardrey, and this is
Reverend Odell Cleveland.
Till next time.
Thank you.